When people imagine medieval Africa, they are often told a story of disease, superstition, and backwardness. But long before European colonization, African societies built sophisticated medical systems that treated the body, the mind, and the community. There were trained specialists, pharmaceutical knowledge, surgical practices, and organized centers of healing. This is not mythology. This is documented African science, and today, we're uncovering it. Pre-colonial African medicine was not random or primitive, it was holistic. Illness was understood as a combination of physical imbalance, environmental conditions, emotional stress, spiritual disruption, and social conflict. Healing was therefore never limited to treating symptoms. It focused on restoring balance between the individual, the community, and nature. This approach created a system where medicine, psychology, and social health worked together, something modern healthcare is only now beginning to rediscover. African societies developed highly specialized healthcare roles. There were herbal physicians, known in different regions as Alagbo, Dibias, or traditional medical doctors. There were bone setters who treated fractures and joint injuries. Midwives who managed childbirth and maternal health. Spiritual specialists who treated trauma and psychological illness. And in some regions, trained surgeons who performed invasive medical procedures. Medical knowledge was carefully passed from one generation to the next, creating continuity and expertise. One of the most impressive aspects of African medicine was its pharmaceutical knowledge. African healers identified medicinal plants with powerful chemical properties. Some plants contained natural salicylic acid, the same compound used in modern aspirin. Kaolin clay was used to manage diarrhea and stomach illness. Certain plant extracts were used as natural antibiotics, later confirmed by 20th-century laboratory research. Malaria treatments were developed using herbal combinations with effectiveness comparable to modern anti-malarial drugs. This was not guesswork, it was empirical science built through centuries of observation and experimentation. Contrary to popular myths, surgery existed in pre-colonial Africa. Medical practitioners performed bone setting, wound stitching, cataract treatments, wet cupping therapy, and controlled bloodletting for specific conditions. In Ethiopia and parts of West Africa, foreign observers recorded shock at the precision and cleanliness of surgical procedures. Plant-based anesthesia and antiseptic herbs were commonly used to reduce pain and infection. These techniques reveal a deep understanding of anatomy and medical risk management. African medical systems were not limited to individuals. Many societies practiced organized public health strategies. Community sanitation rules were enforced. Agricultural health was protected through rainmaking rituals linked to food security. Outbreaks of illness triggered community-wide interventions. Rulers understood that health was tied to social stability, food systems, and environmental management. This shows an early understanding of population-level healthcare. The word hospital as we understand it today is European in origin, but Africa had equivalent healing institutions. These included healing sanctuaries, community medical centers, and houses of specialized healers. Patients came for diagnosis, treatment, recovery, and long-term care. Medical training took place through apprenticeship inside these centers. The major difference is documentation. Unlike Europe, African medical systems relied on oral transmission and practical training rather than written hospital records. That does not mean the systems did not exist. It means they were preserved differently. So how do we know all of this? Evidence comes from multiple sources: archaeological findings of medical tools and medicinal plant residues, linguistic analysis showing specialized medical vocabulary across African languages, oral traditions describing healing practices and institutions, early Arabic and Portuguese accounts documenting African medicine, modern ethnographic studies tracing living traditional practices back to pre-colonial roots. When these sources are combined, they paint a clear picture. Africa had organized medical knowledge long before colonial contact. Colonial narratives depended on portraying Africa as backward. Acknowledging African science, medicine, and knowledge would have destroyed that justification. So these systems were ignored, minimized, or deliberately excluded from education. But the truth survived, not in colonial textbooks, but in culture, archaeology, language, and living traditions. Africa did not lack science, it built it. If this documentary changed how you see African history, then this channel is for you. We uncover the stories that were erased, ignored, or hidden. Subscribe and turn on notifications for more real African history every week.